Ambulance, what's the town or suburb of the emergency? Caller, can you hear me?
Yeah.
What's the suburb of the emergency?
Head.
Pardon?
My grandfather has hit his head.
All right, we'll get some help out for him there. What was your name?
Kaitiana.
Thank you, okay. And you said your granddad's hit his head. How did that happen?
He won't tell me because he's a little bit dizzy and he's lost his speech.
Okay, and when you say he's lost his speech, what does he sound like?
He says he wants to talk but he can't.
He can't? Okay. And did you see what happened?
No, I was getting ready for school.
Getting ready, okay. We'll get some help out there.
Clear left.
Okay, I need you to ask him to smile.
Okay. Can you smile?
Was the smile equal on both sides of his mouth?
No. No, okay.
Now ask him to raise both arms above his head.
Yeah.
And what was he able to do?
Not fully straight.
Not straight, okay.
Juggling. Alright, now we've got help on the way.
No, not enough wrong. Unless you want to get on the garter.
And has your granddad ever had a stroke before?
I'm not sure.
Clear left so far.
Now, I just want you to reassure your granddad that help is being arranged. So I want you to watch him very closely until they get there.
Might be a bit of a chaotic scene initially. It doesn't mention that there's the parents of the children on scene, so...
Oh, damn.
Big smack.
We little stop.
We do. Do you want me to do it?
Yeah.
451.
451, go ahead.
We've just witnessed a three-vehicle significant nose-to-tail. We're going to have to stop here and attend this scene.
Roger that.
We'll attach to that case, find another for your current case, stand by while that handover happens.
Ramping up.
501334, you're responding as primary and only to a case of 79-year-old male conscious and breathing with slurred speech. This case was originally attached to a different car, however, they've had a field initiated. Code 1, thank you. 501334, noted, thank you.
Every day, Queensland Ambulance receives more than 3,500 calls for help.
I had a bloke on a ladder and he fell down and he's on the ground unconscious.
I've got a 67-year-old who's got chest pain.
It looks like she's going into shock.
Well, we're getting help there for her right now. What's your name?
For the first time, our cameras go to Brisbane, behind the scenes of Australia's busiest paramedic service.
That E-team is ready to roll.
We're going to get him cut out.
It's all right. My partner's going to bring the ambulance around. 3, all critical.
With exclusive access, we follow emergencies from the operations centre.
My son stopped breathing.
I've shot myself with a nail gun.
My water's broke.
Do you know how far the javelin's gone into his groin?
To the life and death decisions of the paramedics on the road.
City Code 1, CPR in progress.
Get in the car. What have you got there?
Good news is we know what's going on, mate. The bad news is it looks like you're having a heart attack.
Behind the lights and sirens...
Oh, wow.
You're in the best hands you can be in, OK?
These are the true stories
And how's your pain at the moment, darling?
of Queensland Ambulance.
Just a few questions, all right, and I'm going to get some help for you.
Knock, knock, ambulance.
You definitely did the right thing by calling.
You did so well.
Brings a tear to my eye.
Even just to hold someone's hand, I love to feel like I've made a difference in someone's life.
It's the start of the morning shift at the Brisbane Operations Centre.
Good morning, 501108, reading you 5 from 5. I'll send a test page through now. Have a good day.
555 also, test page received. Have a nice day.
Where more than 250 call takers and paramedics are on duty.
Right. You missed a bit. What? You missed a bit. There and there and there.
On any given day, the Operations Centre can expect to dispatch ambulance crews to more than 1,200 incidents.
His hands are it's Russian roulette as to what you're going to get. And that's with any call you have. It really is luck of the draw. You don't know what's happening.
Mid-call, he cuts off his ear. And I'm like trying to like...
Cuts off his ear?
Yeah, I hear it. I'm like, well, who's that man screaming? And she's like, he's cutting off his ear.
With
and
what?
I'm like, can you find the parts and put them in a plastic bag?
With what?
Scissors.
Okay, tell me exactly what happened.
Looks like he's gone down through the traffic and hit a bus.
A car's hit a bus?
No, motorbike.
Motorbike.
Someone's riding the BMX track and they stacked the jump and they hit their face really hard and he's like having, I don't know, he's sketching out.
My partner's having problems breathing. He's on the floor. He's 55.
A 000 call has come in from Woodridge.
Is he changing colour?
He's a bit white, grey.
And is he claiming or having cold sweats?
Yeah, he's having cold sweat.
A man has collapsed on the ground with a suspected heart attack.
Does he have difficulty speaking between breaths?
Yes.
2 emergency vehicles are dispatched. Ambulance 1478 is the nearest available crew, 4 minutes away. Critical care paramedic Sophie is also dispatched. She is 6 minutes away.
When I applied to become a CCP, I was coming into it as a bit of a minority, being like a young female in maybe an older male population in the role. But it's becoming more diverse and there's a lot more females in the roles, so it's exciting to be a part of that change. The best bit about the job is being able to help someone in the worst day of their life.
CCP Sophie has a higher level of medical training, allowing her to take the lead in more extreme situations.
Level 3-7, the crew have advised they're now to complete heart block, some small episodes of conscious VT, and it's now reverted back to heart block.
Roger, I'm not long away.
Heart block is where the heart beats too slowly, while VT is caused by improper electrical activity in the heart. The patient is suffering both, each of which is life-threatening.
Hello, hey guys.
Okay, so this lovely gentleman, 55 years old, had some pain yesterday, which self-resolved. This afternoon about 1 o'clock, he's had an onset again of the pain. 1 o'clock this afternoon, central chest
significantly
heaviness,
reduced.
with right arm radiation significantly easier. Yeah. So I need to ask you a heap of questions, okay, mate? If you are having a heart attack, we want to give you a few more medications, all right? Okay.
Hey, how you going? Can we start with just a stretcher at the bottom and a stair chair? Thank you.
All right. You're not on any current anticoagulants? No blood thinners? No? All right. No active bleeding at the moment. I know I did ask you before, you haven't had any blood in your poos, wheeze, nothing? Have you heard of something called haemophilia?
We'll just get a V4R.
You haven't ever been
just
told
a
you've got
V4R.
any issues with clotting disorders? No. So no issues with...
the blanket, please.
Mate, we're going to do the best we can, but we're actually going to take you down a staircase soon and we won't be able to have a blanket on you, OK? Yeah. Well, so let's sort the heart out and we'll get you warm as soon as we can. Yeah, can you crack a heating blanket down the bottom? Heating blanket down the bottom. So I've got it.
Going good.
Is it gone? It was a 7 when we got here. Have you got pain still? No. No, okay.
No pain.
Could be wrong about heart attack.
Look, this is what we're trained in sort of identifying. So you have a little blood clot in one of the vessels in your heart that's occluding blood flow. And
How do you know that now?
Based off the ECG changes that we're seeing, we're pretty highly trained in this sort of thing. The good thing is your heart rate's picked up a little bit more and your blood pressure's looking really good.
All right, we're going to get you up. We're going to help you onto this chair. Once we get you on the bed, we've got a blanket heating up ready for you, okay, to try and get you a bit warmer.
And sorry, your name, sorry? Kevin. Okay, we'll start extricating. When we're doing this, can we have one person looking at the monitor at all times, all right? The major risk here is that his heart attack will turn into a cardiac arrest. The outcomes can vary. The outcomes can be really great and that person might walk home with no troubles versus that patient might not survive at all.
The patient appears to be stabilising, but the blood clot means he's still at high risk of slipping into ventricular fibrillation, or VF.
Let's crack on. All right, sweet.
If he goes into VF, his heart will stop pumping blood and he will go into cardiac arrest.
Just relax down there, Kevin. You're doing really well, mate. It appears you're suffering from a heart attack. Okay. Yeah, mate, you got to listen to those feelings, hey? Yes.
We've heard that one before. This one is another one of those blood thinners to help with that clot, okay?
So mostly with these medications, we're trying to sort of hold fast and make sure that the clot doesn't get bigger and bigger and bigger. Because obviously if it completely blocks off that coronary artery, then there's sections of your heart just not getting enough oxygen and blood. All right? Thanks, mate. Oh, too hot? Okay. Sorry?
Getting dizzy.
Oh, yep, let's lay down a little bit. Yes, you are getting dizzy. Okay, guys, he's in VF. So I'm just charging. Pads, are they connected?
Pads are on, yep.
All right, guys, we're going to do stack, shock, 3 stacks. Is everyone clear? Shock, charging. And we've got sinus, I think, but we'll just charge and stop at the thing. All clear, hands off, let's check. I think we still have a VF. Yep. Is he awake?
Yep.
What the happened?
He's still in VF.
Rest, mate. Just rest your head back for me. Rest your head back.
He's still in VF. Is his eyes going back?
Yeah. Rest your head back for me, mate.
Can you feel pulse?
Cardiovert him.
No, no pulse. All clear?
All clear.
Charging?
Sorry, mate.
No, he's... All clear?
You're right, clear.
All clear. Okay, all clear. 3 shocks.
The patient's heart has stopped. He is now in cardiac arrest.
No, no pulse. All clear?
All clear.
Charging?
Sorry, mate.
The blood clot has deprived his heart of oxygen, but somehow Kevin is still conscious.
All clear?
You're right, clear.
Okay, all clear.
Clear.
3 shocks. In all my years of being a paramedic, I've never witnessed someone to be in ventricular fibrillation and still have a certain level of consciousness. Beebs, I'll get you to jump out the back here.
Happy for me to start CPR?
Yep, start CPR. I'm going to make a phone call for intra-arrest lysis. I want you to bag. So we've just got a bit of consciousness with this VT. So last shock is 30 seconds. We're going to analyse at 2.
You're okay. You're okay.
It's not going to have too much effect on him with cardiac arrest. Okay, it looks like we've still got a VF, guys. I want you to draw up some adrenaline after that. You're analysing at 2 minutes and shocking if required. I'm making a phone call for intra-arrest lysis. Are we all on the same page?
Yes.
The whole plan has now changed. My concern now is breaking this clot up.
You're doing really well,
Sorry,
Kevin.
honey, your heart's
Okay, guys, I'm charging.
Yeah, keep doing what you're doing, mate, all right?
Sorry, Kevin.
Hey, Jay, Sophie from Logan Paul. Can I get through to the doctor straight away, thanks? Guys, all clear, hands off.
Everyone clear.
Everyone clear. I see VF and shocking.
Sorry, buddy.
Hi, Sophie, it's Steve.
Hi, Steve. Hi, mate.
Hello.
Okay, sorry. We've got a patient here, confirmed STEMI, accepted for PCI. He's a 54-year-old male. We've given heparin ticagrelor. He's had a VF arrest. Currently had 3 stack shocks, 2 minutes of CPR with consciousness. He's now had another shock, still in VF. I'm calling a consult for intra-arrest lysis.
Sophie needs approval from QAS Medical Director Dr. Stephen Rashford to use a high-risk clot-busting drug.
Yeah, no, how long has he been in arrest for, Sophie?
He's still only 4 minutes, but he's still refractory VF.
Okay, no, how much does he weigh?
75 kilos.
Okay, so why don't we give him 40 milligrams of Connectiplay? And, just do another cycle while you're drawing that up and shock it. If he's still in VF at that point, give him the Connectiplay 40 milligrams.
Okay, I have the medication we're using to thrombolyse called tenecteplase is a pretty high-risk medication. Obviously, it causes bleeding because our intention is to break up a clot.
Everyone clear. Clear.
Still VF.
However, looking at the patient's current situation... OK, Jess? Their heart's not beating, they're not breathing. The risk is that, yes, it might cause some sort of serious bleeding. You're doing good, guys. But the risk of not giving it is this patient's going to die.
All right, adrenaline's in.
And just don't push the amiodarone until we see if this works.
Yeah, that's in.
OK, team, I'm going to charge. All right, guys, hands off. Everyone.
Dan, hands off. Right.
All clear?
Clear.
OK.
Can we get it straight back?
Oh, turn off.
Sorry, Kevin.
OK.
Okay, tenecteplase is going in.
Our priority is to save this patient's life. So our priority is to administer what we need to administer, do what we need to do to save his life. Jess, can you take over CPR?
Yeah.
All right, we're charging now, so let's do it on the charge. This is something that is not a routine thing at all. It's quite risky.
Okay,
but at the same time, so is cardiac arrest, so is death.
Kevin's heart is not pumping on its own.
Ready, Ben? Yep, go.
Okay.
The paramedics are the only reason he's still alive.
Yeah.
The clot-busting drug now in his system.
All right, and I'm going to be charging.
They have to keep their CPR going to give the drug a chance to work.
Okay, all clear?
All clear.
I still CVF, you CVF?
Yeah.
Shock. Okay, let's push adrenaline, and can we push that amiodarone first?
Yeah.
Here we go.
It's in your pocket. Yeah. Thanks.
Yeah.
If the clot is cleared enough, each time they defibrillate,
Okay, we're charging.
there's a chance Kevin's heart may reset successfully and start beating on its own.
Okay, everyone clear.
Clear.
Confirming VF.
Yeah.
Shocking. Cool. That's 9 shocks, so. All right, we're charging. Keep going, folks. Keep going. Okay. Everyone clear. Confirming VF.
Yep.
10 shocks, and still Kevin's heart hasn't restarted. He has no pulse.
Guys, we're probably going to start heading to hospital, okay?
Yep.
CCP Sophie and her team are forcing the clot-busting drug tenecteplase through his body by CPR.
Okay, I'm coming in.
They're hoping it will break up the clot before it's too late.
We're going to have to be doing CPR on our way now.
The longer Kevin's heart isn't beating on its own,
Charge.
the higher the chance of his heart dying.
Okay. All right, everyone clear.
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 We're still in VF.
Yep, VF. Shock.
Shocking.
I probably never thought about death before being in this job at all. And I've been in this job since I was like 20 years of age. Okay, I'll take over CPR and she can do some ventilations.
Just start moving. I'll get everything ready.
Just gentle, Phoebe. It's quite a traumatic experience. Like, you're doing CPR, you're really, like, ribs break, like, the patient can have blood start to come out of their airway. Like, it's a traumatic experience trying to resuscitate, trying to manually pump someone else's heart. Okay, guys, all clear?
All clear.
Clear.
Confirming VF.
Yep. When you're in the middle of doing a resuscitation, you are just thinking so clinically. You've got an outcome you're trying to achieve. And although there is some emotion about, you know, this person is in cardiac arrest. Okay, back down, let's analyse. You want to try to save their lives. Yeah, shock it. All right, keep going. Nice, firm CPR. Let's try to push that tenecteplase around. I've got a whole team that I'm guiding. You can't just be emotional yourself because your job is to be their pillar so that you can be strong for them. The outcomes can vary. The outcomes can be really great and that person might walk home versus that patient might not survive at all. So our priority is to do what we need to do to save his life. All right, guys. Still no pulse, still VF. He's had 13 shocks. And CPR, we've got metronome core patch. He's had 3 adrenalines, 450 of amiodarone. He's had 40 of tenecteplase, 6,000 of heparin, 180 ticagrelor, 300 of aspirin, and 50 of fen. Is that correct?
And 8 of Ondans.
And 8 of Ondans. Okay.
I really hope that we can get this patient to hospital in a state that he can get the cardiac care that he needs.
Okay, Jess, once you've done that, I need you to give half a ml of this.
We don't just want patients to survive. We want patients to survive back to normal outcome.
We'll lower the stretcher down and everything, so we're good now.
You good still?
Yes.
This is down, I'll take it.
Okay, lower the stretcher. Okay, guys, wait, let's connect the O2. I got the bag.
Okay, O2 is connected.
Okay, guys, let's stop. We need to stop. We're going to charge. Phoebe, charge. Okay, guys, stop. Rhythm analysis. I've got a pulse. It's a rate of 20. Cancel shock. Continue CPR.
Okay, let's go.
Yes.
Rate of 20. I can feel a weak carotid pulse. He's alive.
This case was one that I'll remember throughout my career. It was an extremely long resuscitation with a very, very sick patient with a reversible cause that we had to work really, really hard to try to fix and really hope that he survives. And not only that, but is able to go home to his family and live his life like he did before this event today.
All right, my pleasure. Bye for now.
Tell me exactly what's happened.
There's a rodeo happening here, and a man's just been sort of hit in the face by a bull.
My daughter, she put one piece of in her nose.
My son has a cyst between his face, and he's just in absolute pure agony.
Ambulance, what's the town or suburb of the emergency?
My daughter's in labour, and she wants to push now.
Okay, now are you with her now?
Her partner is, yes.
All right, are you with her though?
Yes, well, she's in the house.
All right,
yes.
you need to get closer to her. How many weeks or months pregnant is she?
She's due a couple of weeks. The baby's coming. Quickly.
Okay, can you see? I need you to listen. Can you see any part of the baby now?
I don't know. Can you get somebody out now?
Okay, they're coming as fast as they can. Can you see any part of the baby now?
Yes, come on. It's blood. It's all bleeding. It's all coming out.
Okay, the head's coming out, is it?
It might be.
Okay, now I'm organising help for you now. You need to stay on the line. Now I need you to listen carefully. Put me on speaker.
Sorry, I can't put you on speaker. I don't know how to do that.
Okay. Now, with each contraction or labour pain, place the palm of your hand against her vagina.
Okay, place your hand against her vagina.
Okay.
Contraction.
Okay, it'll prevent from tearing her. Now, say exactly what I say to him now. As the baby delivers...
As the baby delivers...
Support the baby's head and shoulders.
Support the baby head and shoulders.
And hold its hips and legs firmly.
And hold her hips and legs.
Hold its hips and legs firmly. And remember... Remember the baby will be slippery, so don't drop it.
It will be slippery, so don't let it go.
Listen to me. Have her push hard to get the baby out.
Push hard to get the baby out.
All right. Now have her push hard to get the baby out, okay? I can hear her straining in the background. Yvonne, go and hold her hand, okay? And help her push.
Push. Come on, push, Sarah.
How much of the baby is out at the moment?
Half his head. He's stuck.
Okay.
Push, Stephanie.
Tell the mother to lie flat, grab her knees and pull them to her chest.
We're grabbing.
Okay, that's it. You're doing a great job. And tell her to push hard to get the baby out.
Push. The head is just sort of stuck, so push.
Another big push. Her knees need to come up further. She needs to push harder.
Push, get your knees up to your chest harder.
That's it.
Keep pushing.
You're doing a great job. Encourage her to push hard, okay?
Okay, try pushing harder. Oh, shit.
Hold on to the baby.
It's coming out. That's all right.
They're very slippery. Do not drop the baby. Hold the baby firmly, okay? Is the baby completely out now?
He's out.
He's out? All right, congratulations. Now, is the baby crying or breathing?
Yes.
Okay, that's great.
Do you know how far away the ambulance is?
They're coming to lights and sirens. I'll be right with you until they get there, okay? Now, do not cut the cord, okay?
No, we're going to leave the cord there for the ambulance guy.
Now, the afterbirth should start to deliver soon. Can you see any of the placenta?
No, can't see because of where he's lying and we've got the towel over here.
No, that's okay.
His eyes are open.
His eyes are open? Oh, that's great. That's great. Have you got a name for him yet?
Yes, Roman.
Roman, is it?
Yeah.
That's such a great name. And how's Mum doing at the moment? Is she excited or a little bit?
She's doing pretty good.
She's doing really well. And was this her first delivery?
No, second.
Her second.
I've got a 4-year-old son and he's asleep at the moment.
Oh, so there's going to be a big surprise when he wakes up. Okay. You did a fantastic job for a very stressful situation. How's Dad after all of that?
Oh, he's doing very, very well.
We'll be happy to see the crew in a moment.
They're here right now. So
They're there?
very much.
That's all right. You did a great job. Congratulations.
Okay, thanks.
Thanks, Yvonne. Bye-bye.
Good.
Oh.
Congratulations.
She's like, the head is coming and I don't know how to use speakerphone. I was like, abort mission.
So she was the grandmother.
That was Grandma. She couldn't use speakerphone and she was freaking out and she wasn't repeating what I was saying. So I had to get her to do it. And she said the head was stuck and I was like,
Yes, I heard her say that. Oh my God.
My heart went, please be the head, not the bum. Being a mum, like you having a heart attack at the same time because you're having to deliver someone else's baby, I always find that I'm a bit weak at the same time. Because I know like the other side of the story when the baby isn't breathing and the baby gets stuck. Yeah, I lost my baby at full term, 3 days over during labour. My pelvis had to be disconnected and my baby's collarbone broken to deliver him when I had a 3rd term hemorrhage during that birth as well. So it became one of those really scary births that you don't want to tell people about. And I was only 18, so I kind of relate to the young ones and the scared ones, and I know that I would feel it greater than some other EMDs because I've been through it if it goes bad. So yeah, I just try and make the best of it, try and control the call as much as I can and get baby out safe, whatever I have to do. Ambulance, what's the town or suburb of the emergency?
It's the beginning of the Saturday night shift.
Just take some deep breaths for me. We're going to get some help for you, okay? And about how long ago did he start choking on the meat? So what's the main concern tonight? So the fact that he's fallen off the bed or that he's having trouble moving his bowels?
On average, the Brisbane Operations Centre can expect to dispatch paramedics to an incident every 64 seconds.
Well, he should have heard Jerry before. He's like, as you can appreciate, it's very busy being a Friday night. And I'm like, Jerry, it's Saturday.
I was like,
But tonight...
501324, go ahead.
In addition to caring for Brisbane's population of 2.4 million...
Extremely intoxicated, vomiting non-stop, had cannabis as well.
Ambulance crews are on standby to provide emergency assistance at 2 major city events, River Fire and a music festival, drawing 500,000 extra people into the city.
And also because the
Bridge is shut.
bridge is closed.
So we need a south side crew to get across to him.
Yes.
Okay.
So you'll need a south side crew.
601457 logged on Balmoral night shift.
457, ready 5 out of 5. This page coming through now. Have a good night.
Thank you. We're just going to head out local and hopefully watch the fireworks for a bit if you haven't got any work for us.
Clocking on for their 12-hour shift are paramedics Sarah and Alicia.
Saturday River Fire. Woo! I know. Hopefully we can see at least just a little bit.
Maybe if we get a job in that direction, so as we're driving towards the job, we can see the fireworks.
Yeah. Oh! Oh!
Oh, there is some. Yay! Oh, wow.
It's going to be a fantastic night.
All right, he's passed out. Okay.
I'm not a doctor. I can't explain it.
Don't yell, please. I know you're not a doctor, so just asking you to describe the symptoms that you have at the moment.
I'm not feeling good.
Yeah, so when you say you're not feeling...
Look, how about I just lay on the ground in the middle of the road, then you just come get me?
So his ankle was sliced open on glass.
Ambulance, what's the town or suburb of the emergency?
121, go ahead.
The music festival has been in full swing since midday. The operations centre is experiencing a surge in the number of calls.
I've tried MDMA tonight for the first time, and I'm not in a good state.
Most involving the drug MDMA.
I kind of feel like I'm overdosing. He's been in and out of consciousness, eyes rolling to the back of his head. She's not doing any drugs tonight, she's passed out.
My heart was just going and hurting from now and then. Yeah, so just hurting and hurting for something there.
Brisbane paramedics are dealing with the rush of MDMA overdoses.
She's taken MDMA at about 1900 hours.
In car 6457, paramedics Sarah and Alicia are attending to two 19-year-old males. One is in a serious condition and needs to be taken to hospital.
Have you had alcohol since then? Yeah. Any other drug? Okay. Weed, yeah.
On the other side of the river, in car 5451, Ben and Rachel are transporting an 18-year-old female to hospital suffering heart palpitations.
Were you worried you might end up like one of those young girls that die?
I'm going to be one of those people who overdose.
And just confirming it was MDMA that you've taken. And so he was just drinking in the valley, he didn't take anything? Okay, so he took 2 MDMA.
Tonight, drug-related incidents have doubled from a regular Saturday night, stretching resources to their limit.
Sierra 415, go ahead.
451 on your channel for code 1.
326, what are they on?
Have you paged them? Have you heard anything from them? I need them for a code 1.
Booze. I have no cars.
Code 1 indicates a time-critical, life-threatening emergency.
Common call, QS to all units. Common call, code 1, Alexandra Hills.
A common call only goes out for critical cases when there are no available ambulances left in the city.
So any crew that's got their radio on and they're listening, they might be able to clear up at hospital and put their hand up and say, yeah, we can go, because it's code 1 that's pending. We can't really have them pending.
Common call, common call, common call.
You're available to see code 1 to Green Slopes for an RTC.
When you hear common calls over the radio, though, you know that it is crazy out there.
The patient has self-extricated.
601 451 on your channel for code 1.
Touching them now.
Ambulance, what is the town or suburb of the emergency?
We don't have a street address. We're at a bus stop. I called previously for an ambulance that hasn't arrived.
Okay. And you're near a bus stop?
22-year-old male in the bus stop 6.
601 457. We've just been flagged down by those guys. I'll just stop and have a quick chat to them and I'll give you an update. Was that legit?
Yeah. Cheers, thanks, 457.
Sarah and Alicia are already full with 2 19-year-olds they have just picked up.
My name's Sarah. I'm with the ambulance. Tell me what's going on. You can come and have a sit back down. We're just going to have to get another ambulance because we've got someone on our stretcher. Come and have a sit. Yeah, we've actually got a patient on board, so... What has he had tonight?
Earlier on at the house, I believe one of our housemates gave him protein.
Okay.
And then a little bit of MG, like minuscule amount.
Okay. Do you know how much?
Tiny.
Just left upper quadrant abdo pain, started while he was walking across the bridge, has had MDMA and alcohol.
It's a theme.
Yeah.
With no available ambulances to attend to the patient, Sarah and Alicia need to find a solution.
I mean, he could sit in the patient care seat and I could stand.
Drugs frustrate me, particularly on nights like tonight when I know that they're taking up lots of resources. Any sort of music festival, if even 1% of them called the ambulance, that's going to take up every single ambulance in Brisbane. 601-457, sorry to interrupt. We've managed to get the second patient into the ambulance as well. We're going to transport both up to the MARTA.
Thanks, guys. Thanks for your help in the city tonight. Hopefully we can get you back north.
We often hold our tongues and sometimes you just go, I can't do it, I can't hold my tongue anymore, I just need to lecture these guys.
You three need to stop taking drugs.
But you don't judge people for what they do when they're not well, they need an ambulance. So we get them a car.
Ambulance, what is the town or suburb of the emergency?
I exercise very much, and therefore I really push myself.
A caller named Francis has rung 000 3 times. The high demand from drug overdoses is putting a strain on resources. He's been waiting almost 2 hours for an ambulance. This is his 4th call.
I'm in pain.
Oh, right. Well, I'm just going to get one of the paramedics to have a quick talk to you, OK?
Worried about the wait time, call taker Jared transfers the call to Clinical Deployment Supervisor Nathan. A qualified paramedic, he'll reassess the urgency of the job.
Are you the patient we're coming out to?
Yes.
Whereabouts are you in pain?
All over my body.
Okay. Can you be a little bit more specific? Is it more to your legs? Is it in your chest? Is it in your head?
My feet.
Your feet. Seems more like a chronic issue. I have upgraded, it was a 2C, so like a really low acuity, and I've upgraded it to a 2A just because of the time. So we'll try and get out to him and see if we can help him.
Sore feet from exercise. He's having difficulty mobilising because he's got sore feet from exercising? Is that what you got from that?
Yeah. When you decide to do this job, I think most people think about the critically ill people and people who are about to die and the really life-saving stuff that we do. The more you do it, you realise it's not all about that.
It's not a call that you expect when you think of an emergency service, having sore feet and trouble walking. So I think the fact that he's called, that makes me think that maybe there's more to it. Maybe there's some social stuff. Maybe he's just not very well educated in how to look after his own health.
Yeah.
Be interesting to see.
I grew up on a farm west of Brisbane, near Toowoomba. When I left school, I went to study science. I thought I wanted to be a researcher, and then quickly realised that the career options involved a lot of sitting inside, doing the same thing for many years, and then this job just popped into my head, and I love it. It's the best job in the world.
Second floor. Hello, sir. What's your name?
Francis.
Francis. My name's Rachel. This is Ben.
Hello, sir.
Are you our patient?
Yeah.
Have a seat somewhere for us so we can chat.
If the job's at the back of the house or in a further room, I'll be having a look around to see how neat, tidy the house is. That's going to give me an eye of the social demographic that I'm working in. It gives you an idea of the living situation. And of course, everyone's living situation is going to impact how they're managing their own health.
Francis, tell me a story, mate. How can we help?
I really pushed myself exercising.
Okay.
And I've been aching ever since.
Right.
I was just wondering if you can get painkillers.
Well, can I ask some more questions first?
Yeah, of course you can.
Thank you.
If you bring any judgment into a job, that's instantly going to give you some bias and maybe make you not make a very good assessment.
What kind of exercise did you do?
Squats.
Squats?
I pushed myself to the absolute limit. It does your whole body.
It does do your whole body. Yeah, they're not my favourite activity.
Oh, they're hard.
How many do you reckon you did?
1,000 and half an hour.
Empathy is very important on cases like this. You've just got to remember that everyone's got their own story. The same way that all of my upbringing and life experience so far make me, everyone's got their own version of that.
Francis, do you normally have any medical conditions?
Yeah, I'm schizophrenic.
Schizophrenic, okay. What about problems with your heart or your lungs?
No.
All right. Now, as for what we can do for your pain, this is about all I can give you for pain is Panadol.
I knew that.
Yeah. Give you those two? All right. Now, given that us as an ambulance can't give you anything for the muscle pain, that's about all we can do.
Yeah.
If you wanted to go to hospital, we'd be happy to drive you, but...
I don't think that's necessary. It's not going to get any better.
The other thing that we could offer you tonight is a phone number for a service called Support Link. And they have a number of services to help you around the house if you need it.
I think our job's quite unique in that we are one of the only medical professionals that actually see people's living environments. So I think we have a duty of care to assess that when we're there, and if we deem it to be, potentially not ideal, it's our role to, I think, at least offer some support to those patients.
Maybe you should give yourself a break from the squats for a couple of days.
Doing less.
Okay, I think that's a good plan.
Just 500.
Just 500. That's still a lot. It's more than I think that's more than I've done collectively in my life.
Yeah.
So how do you do the best kind of squat? You got something like that?
Yeah.
Do you put your hands out?
No.
No? Just by my side?
Yeah.
All the way down?
Yeah, that's a bit too far.
A bit too far. Somewhere in the middle. I can feel the burn already. I don't know how you did 500. All right. Pleasure to meet you, Francis. Take care, okay?
Okay.
Look after yourself.
All right.
I love this job because it strikes this good balance for me where I still get to use lots of critical thinking, and it's a very scientific job in one way, but at the same time it's very much a personable job where you just talk to people in the community, anyone from little kids to 40-year-old drug addicts to little old Nana who lives on her own. So yeah, there's not many jobs I think that hit that sweet spot the way this job does.
Yes, amazing. That was one of the poorest living situations I think I've seen in this city, in this job.
Same. Ever.
Ever.
Yeah. I would have been equally surprised if I walked in that room and I saw you squatting or him squatting, and it was you. You really go the extra mile.
It's like there's not a lot I can do medically for that job, but I may as well have a laugh with him and make him smile. Like there's nothing else to do.
Laugh, at least.
That's where I get the enjoyment from this job half the time.
Yeah.
It's just talking to people like that.
Next time...
Ambulance, are you reporting an emergency?
Friday night in Brisbane goes awry.
He's tuned his face off.
Do you think he's all right?
As paramedics face their fears.
You don't intend on hurting me or Matt?
With a disturbing laceration.
God, I can see my inside.
And a violent home invasion.
I stabbed my father-in-law, my friend, and my husband.
5 people have been stabbed.
Pushing the limits of paramedics.
3, all critical. Who do you think is the most priority?